Breaking news tonight. 5 cases of the Omicron variant of COVID-19 turn up in New York. It comes as our New York communities confront a healthcare crisis.
In the last hour, we learned of the cases of this new variant turning up in New York City. We now know one person had traveled to South Africa.
Now is when we explore what's next for you, your loved ones, and the entire state of New York.
After what seemed like progress in our fight against COVID-19, now taking a turn to a major setback.
For the Thanksgiving long holiday weekend, New York State went into a state of emergency. A new governor now facing a more complex crisis than was presented a year ago. Hospital rooms beginning to fill up once again.
Hospitals across Western New York are at or near their staffed bed capacity.
Only this time, staffing creates a crisis. Hundreds of workers quitting or laid off after state-imposed vaccine mandates. And the ones that are still there are being pushed to their breaking point.
We've seen entire families be wiped out. And we shouldn't have to be put in that situation anymore.
Now there's a vaccine for adults and children, and even a booster shot. But as leaders push to get more people vaccinated, breakthrough cases and the unknowns of a new variant present new challenges.
Please, please, please get your booster shots, get it scheduled.
Should more be done, or is this the new normal for our new New York? The health of our economy, our schools, our neighbors, and ourselves is once again the center of conversation. This is what you need to know with context and perspective as our new New York confronts a healthcare crisis, the new variant. And good evening, everyone. I'm Megan Coleman.
I'm Michael Benny. Tonight, we are live in Syracuse, and you're watching live on the web, a mobile app, or a social media platform of one of your trusted local news teams.
In Albany, that's CBS6Albany.com. Our Capital Region team is bringing us reports from that community and New York City tonight.
In Syracuse and Central New York, it's CNYCentral.com, where we have live guests waiting to answer your questions over the next hour.
In Rochester and the Finger Lakes, our 13wham.com audience will learn more about a state of emergency enacted in that community this week and what all of this means for our communities.
And in Buffalo, our Western New York neighbors are watching on foxbuffalo.com as cases rise to unprecedented levels more than a year and a half after the start of this pandemic.
Over the course of the next hour, we are digging into where the pandemic stands tonight and how it's impacting local hospitals and schools and where we go next.
And we'll bring in voices from all over the state with perspective that stretches far beyond our own backyards.
We've got a lot to get to tonight. We're focusing on the healthcare crisis currently impacting not only New York hospitals, but also your primary care doctor visits and efforts to get loved ones into nursing homes.
We'll also hear from workers on the front lines of this, burning out from the continued waves of pressure they're facing as fellow workers leave their jobs, whether by force of a vaccine mandate, better pay somewhere else, or exhaustion.
We are pushing to see how local leaders are responding and whether the response needs to go further.
And looking at how this pandemic and the healthcare crisis will impact you from school to the economy. We start right now with the news that is developing as we speak. President Biden's new campaign for Americans to get protected against the Delta and Omicron variants. It's a 9-point plan. It includes boosters for every adult, vaccinations to protect children, expanding free at-home testing, stronger public health protocols, protections in the workplace to keep the economy open, rapid response teams, supplying treatment pills to help prevent hospitalizations and death, as well as continued commitment to the global vaccine effort and steps to ensure we're prepared for every scenario.
The president presenting that plan to the nation today.
Christine Frizzau gives us a look at his message.
They've been at times hard to come by, but those at-home COVID tests will now be more readily available, and the cost covered by private insurance if you have it, and available for free as well for those who don't.
Bottom line, this winter, you'll be able to test for free in the comfort of your home and have some peace of mind.
President Biden laying out his multi-pronged plan to try to better arm Americans in the battle against COVID-19 and its new variant, Omicron. The plan includes new guidance for travel, including requiring international travelers show proof of a negative coronavirus test within 1 day of departing for the United States, and extending the mask mandate for airplanes and other public transit, set to expire in January, to at least March of next year, increasing access to boosters and medications shown to be effective in fighting COVID, and accelerating vaccine distribution to the rest of the world.
This is a global pandemic, and everyone needs to fight it together. And that includes countries we're helping that aren't particularly friendly toward us.
One of the central tenets of the White House plan is to continue the effort to try to get as many Americans vaccinated as possible. Health experts say to this day it also remains the greatest challenge.
We have 60 million people in this country who are not vaccinated, who are eligible to be vaccinated. Let's get them vaccinated.
Some Republicans blaming vaccine hesitancy on muddled messaging from the White House and constantly changing guidelines.
They'd be better off actually saying that voices like ours from the right would actually be voices that might encourage some people to get vaccinated.
Other challenges for the president: falling poll numbers for his handling of the pandemic amid an inability to live up to this promise made at a presidential debate in October of 2020.
I will take care of this. I will end this. I will make sure we have a plan.
The latest version of that plan looking a bit different, heading into the second holiday season, overshadowed by COVID-19. I'm Christine Frizzau reporting.
And the president's plan on this comes as parts of New York see record high COVID levels.
We start with the western region of the state, where Buffalo just saw its highest number of cases since the pandemic started. Here's a look at the 4 biggest counties down the thruway. Erie County is seeing unprecedented caseloads, day after day breaking all-time records. Today, 948 cases, a positivity rate over 10%.
Let's move to Monroe County, the Rochester area, the latest New York county to declare its own state of emergency over COVID. 658 cases reported today. That's the highest number since the middle of January.
Onondaga County has not declared a COVID emergency at this point. The county executive says hospitals are in a good place. 384 cases this Thursday, a big increase after the holidays. And Albany County recording 202 new cases.
Now, those cases are not the metric most counties are using to track the level of concern here. It's this: the hospitalizations. Because as hospitals fill with COVID patients, it creates other issues for non-COVID patients who also may need critical care.
Erie County has 353 people in the hospital with COVID right now. Moving east, Monroe County and the surrounding Finger Lakes region now has 464 people being treated for COVID in hospitals, according to the state. Onondaga County has 130, and Albany County has 53 people hospitalized with the virus right now.
Tonight, we have Fox Buffalo's Emily Gersh with a deep dive into the state of hospitals across the state.
On Monday, Erie County Medical Center in Buffalo exceeded its maximum capacity for the first time in the hospital's history. They had 576 patients. 74 were COVID infected and 50-plus emergency room patients in an ER built for 50.
We basically had no emergency room this morning. We could only see people in hallways and things.
Dr. Sam Cloud, Associate Medical Director for ECMC, says the recent COVID surge, combined with losing 1 in 5 workers since the pandemic began, has left the hospital in dire straits.
You can imagine if we're maximum capacity and then you've lost a bunch of healthcare workers, then that's very difficult to handle. It's a double whammy.
In Rochester, Monroe County Executive Adam Bello announced a state of emergency due to the rising number of COVID hospitalizations. Almost 50 more in Monroe County, nearly 60 more in the Finger Lakes than last week.
We need to flatten the curve of hospitalizations now before the situation reverts to what we experienced last year.
The chief medical officer at the University of Rochester Medical Center, Dr. Michael Apostolakos, is pleading with the community to get vaccinated as elective surgeries are being postponed due to lack of beds.
My heart goes out to our patients. What we believe medically may be safe to postpone for a week or two to someone else, it's going to be heart-wrenching for them.
The 3 major hospitals in Syracuse combined have a total of 94 COVID patients and not enough staff to care for them.
It's really not the beds, it's the staff.
Bea GRAUSE, president of the Healthcare Association of New York State, says the staffing issue is having a domino effect, as dozens of patients eligible to transfer or return to nursing homes are unable to due to staffing shortages.
If they could be discharged, then we could free up some more beds, and we'd have more hospital staff who could care for patients who needed to come in.
And in Albany, St. Peter's Health Partners has canceled elective surgeries in order to add additional ICU beds, something they haven't had to do since January.
53% increase across the region in just the last 6 days in terms of the number of COVID positive inpatients. So it's rapidly increasing.
In an effort to provide some relief to hospitals, Governor Kathy Hochul's executive order to limit non-essential procedures to hospitals with limited capacity will take effect on Friday. Reporting in Buffalo, I'm Emily Gersh.
So how did hospitals get to this point? Well, it is not as simple as saying COVID hospitalizations went up, so hospitals are more crowded.
Connor White in Syracuse has been digging into this issue for weeks now. He's with us tonight to break down these contributing factors and the domino effect, because that's what this is, on everything from primary care to getting a spot at a care facility for a loved one. Connor, good evening.
Good evening, Michael and Megan. Well, the state is monitoring 37 hospitals statewide with less than 10% of their beds available. 7 of them are here in central New York, including GRAUSE and both of Upstate's campuses in Syracuse. We've heard it from the governor and from health officials that this is about a lack of people, not a lack of beds. To sum it up, it's a nursing shortage studies show has been coming for decades, and the pandemic helped get us there faster. In 2017, the U.S. Department of Labor estimated that by 2030, the United States as a country would be short 1 million nurses compared to the projected demand. That's, of course, a pre-pandemic projection. Jump to 2020, and a difficult nursing job has become that much harder, facing an unknown virus filling up ICUs. Many of us could stay home while thanking them for their heroic work in the early days of the pandemic when we all felt a little more united against it. As nurses at St. Joe's told me in September, that feeling has changed, and so have hospitals. Upstate's ER director says older staff members began to retire in bigger numbers, exposing a shortage of qualified people to replace them. It created a bidding war, and Syracuse hospitals have told us they've lost out to lucrative traveling nurse contracts they simply can't match.
All right, Connor, so the governor has talked about urgent action to try to boost hospital capacity. But has government intervention done anything at all? Has it made things better? Has it made things more complicated?
Well, Michael, in August, then Governor Cuomo announced the state's vaccine mandate for healthcare workers. Hospitals have complied and voiced support for this policy for the most part across the board, as health officials have pushed for as many people as possible to get the shot to end the pandemic. But on a pure numbers basis, it's contributed to the problem. Since the mandate took effect, Syracuse hospitals combined suspended 193 staff members who originally had a religious exemption in November. That's on top of a few dozen or so already let go in September for choosing not to get a vaccine that's been proven to be both safe and effective.
It's a complicated situation, Connor. So with staff leaving for any number of reasons, as you mentioned, wages, burnout, the vaccine, how does that actually translate to our current capacity issues?
Well, Megan, again, without staff, it doesn't matter how many physical beds or rooms you have. Hospitals are now operating with far lower capacity than they did when the pandemic began, as we start the winter period with higher hospitalizations than we did this time last year. So let's zero in on Syracuse with state health department data. In March of 2020, there were 1,229 staffed hospital beds throughout Syracuse, and at the time, less than half were in use. As of this week, the number of staffed acute care beds has dropped to 993. 93% of those are in use. 162 of our 177 ICU beds are full, and 1 in 5 of those patients is battling COVID. 24 of those are unvaccinated.
Boy, okay, that's a lot of numbers. But what about solutions? Can anything be done tonight, tomorrow, next week on this? Or are we just supposed to endure this for the rest of the pandemic?
Michael, we've been asking those kind of questions for the better part of 2 months now, and we've been told repeatedly there's no quick fix. In the long term, healthcare professionals and local officials have said there needs to be more incentives for people to get into the field, including paying for education and increasing salaries. In the interim, they're hoping to find funding to attract talent and hoping more people will get vaccinated to remove the strain COVID patients are currently putting on the system, now entering another winter battle with far fewer staff.
All right, Connor, that is true. We could have fewer people get COVID. That would be a start.
Well, we wanted to know how you are evaluating the hospital crisis that we're seeing across the state.
So we took it to the Public Square Facebook. The state of New York faces a healthcare staffing crisis that impacts our community's health, just as a new COVID variant is making its way here. How would you fix the problem? Shannon wrote to us saying, make college cheaper for nurses, and make healthcare not for profit. I left because they weren't ready for COVID and not following proper PPE, had no masks, and I wasn't risking my life for what they were paying.
Michelle suggesting this: give unvaccinated healthcare workers the option to test weekly or bi-weekly. Healthcare, she says, is one of the only professions that it's not an option.
And Haley says RNs what they deserve, and people give RNs what they deserve, that is, and people will stop leaving to become travel nurses, where they can make as much as 3 times elsewhere.
These rising hospitalizations contributed to the governor's decision to go into a state of emergency. The impact of that will start tomorrow.
Mary Keeler looked at what the state of emergency does and how it's different than the powers ex-Governor Andrew Cuomo had at the start of the pandemic.
Starting on Friday, nearly 40 hospitals in New York State will be ordered to stop elective surgeries as Governor Hochul monitors major issues with low bed capacity and staffing shortages. I asked her about it Monday.
Is Upstate University Hospital in Syracuse one of those hospitals?
Let me check on that. I don't have the list right in front of me. And also, that is our number today. This requirement with respect to eliminating the non-necessary elective surgery, I guess that's what the nature of elective means, goes into effect on Friday. We anticipate that that number of 30-something is going to drop between now and then as the hospitals understand how serious we are about this.
Hochul is also working on getting National Guard members to help nursing homes, measures she can take now that she has emergency powers through a disaster emergency declaration. It allows the governor to waive or override a law unless it's part of the state constitution.
She's got the ability to gear her actions to the day-to-day or week-to-week situation.
Democrat Assemblyman Richard Gottfried is the chair on the Assembly's Committee on Health. He says this declaration is smart on the governor's part, but the legislature is there to make sure she doesn't overuse her power.
We don't necessarily need all the same measures. We don't need to shut down barbershops and bowling alleys, but it is very clear that there are urgent actions that need to be taken.
Republican and Assembly Health Committee member Josh Jensen says he thinks the governor should look at the vaccine mandate for healthcare workers. He believes that is why so many hospitals are struggling to find workers now.
We should be doing more to keep our healthcare heroes on the front lines where they belong. And that's taking away that vaccine exemption, the religious exemption. We were able to have healthcare workers safe and working before the vaccine. We can take those precautions still.
I'm Mary Keeler reporting.
As Mary mentioned, National Guard members as trained as EMTs will be deployed statewide to help try to ease the staffing crunch.
Monroe County is getting more help than any other with 26 National Guard members. Most of them will serve at Monroe Community Hospital.
Loretto in Syracuse is also expecting help from the National Guard.
This is clearly what's been identified as our hospitals is the number one thing we talk about every week. It's the nursing homes.
That's right.
That's really how we free up those acute care beds that people are much need here in our county.
The governor has talked about using the National Guard to fix staffing shortages for months now, and we're about to see that in action.
2 counties in New York along the Thruway have decided to take action as COVID cases soar. Monroe County declaring its own state of emergency.
And Erie County putting an emergency order into place as well, which brings back an indoor mask mandate for all public indoor spaces. And this comes with the threat of more restrictive measures if the COVID numbers get worse.
We're serious when we say if these rates continue, we're getting into an uncontrolled phase that we may not be able to control and stop the further spread unless we have some serious actions taken, including shutdowns, and nobody wants to do it. Nevertheless, I have no interest in doing that. Nobody wants to go back to the days of restrictions and shutdowns, but these numbers are just bonkers, as I said. They're just ridiculous.
That's the Erie County Executive Mark POLONCARZ. He will consider whether to implement further restrictions coming up on the 13th, unless the county reaches full hospital capacity before that deadline.
Yeah, Monroe County followed suit Tuesday morning with the county executive Adam Bello saying rising cases and hospitalizations push the county to that point.
Natalie Cutco looks at what that means for the Finger Lakes region.
Right now, Monroe County is under a state of emergency, including new mandates as hospitalizations surge. The order went into effect Wednesday. The hope is to flatten that upward curve of COVID cases without sweeping mandates or closings. County and hospital leaders are concerned about the drain on healthcare resources, as well as the impact on all patients.
We need to flatten the curve of hospitalizations now before the situation reverts to what we experienced last year. You also have to weigh, I don't want to go back to shutting down the economy where we were a year ago when businesses were forced to close, people were out of work. The impact that had was enormous on our community. We have different tools available to us today than we had at that point last year. The tools being we know more about the virus, we know more about how it spreads, and we have a vaccine that works.
Now, phase one of the state of emergency is requiring masks for all employees and visitors to county facilities. County employees who can are encouraged to work from home. And 750,000 free rapid test kits will be given out for the holiday season. If COVID cases do not decline, the county executive warns more stringent measures could be soon on the way. In addition, 13 two-person National Guard teams are being deployed to Monroe Community Hospital, where they will assist in what capacity is still unknown at this time. In Monroe County, I'm Natalie Kuchko.
Natalie, thank you. Just today, we learned a person confirmed to have the Omicron variant of COVID was at a convention down in New York City. Tonight, we're bringing in new perspective from a journalist who's been covering the pandemic since the earliest days when New York City was in a panic and a lot of people were dying. Katie Honan is a reporter for The City, a nonprofit, nonpartisan digital news platform that's dedicated to hard-hitting reporting that serves the people of New York City. Katie, welcome upstate, if only digitally.
Thank you for having me.
Yeah, I really appreciate your perspective on this. The Omicron news, let's start there, and the fact that a patient who was at an anime convention down there in New York City, how are the people that you've talked to today handling that news?
The mayor and Governor Hochul, Mayor de Blasio and Governor Hochul have urged calm for everybody. It gives me sort of flashbacks to March 2020 because we were told that as well. But we're in a much different scenario now than we were almost 2 years ago. Our vaccination rates are very high. Even the anime convention, there were mask regulations, there were rules. It seems like it could be a test case in just what masking and vaccine mandates and vaccine regulations can do when we have these various variants that are going to keep unfortunately evolving in the city. But there hasn't been that level of panic yet, and we hope that it will not get to it.
Good. The governor's emergency order, you mentioned the governor, it's focused on hospitals and capacity. So I'm curious, what's the situation down there right now on that front?
Things still seem pretty calm. There are a few private hospitals within New York City's limits that say that they have some capacity issues, but we are not reaching that surge and that level that we have. Look, what the vaccines have done is even people, if they do contract whatever variant of COVID, it is milder symptoms. That's what the scientists and the doctors have said. So it's not to that critical level that we saw in the early days of the pandemic in 2020. Yeah. We really had overloaded hospitals.
Well, from upstate, we've watched the situation in New York City change in remarkable ways over the last several weeks and months. I know this week there was a day with no deaths from COVID down there. That was big news. We covered that up here. But now upstate is seeing hospitals crunched, high daily case counts. Are people downstate aware that we've sort of had this role reversal of sorts?
Yeah, and I think we've seen it at various points since March 2020, not just in upstate, but in other parts of the country, seeing what we saw in March and April of 2020, and then seeing it repeat in other parts of, of our own state. There is that awareness, and it is unfortunate because, especially what we dealt with in New York City, we would hope that people would have seen that as a warning and maybe adjusted their behavior, whether it's at a government level, like a municipality level, or a personal behavior. In the things that we found helped mitigate the spread of the virus, mask use, and then now that we have it, vaccination and the booster shots that are also available.
Yeah, like we've seen this movie before is probably how a lot of folks downstate are watching what's going on up here. I'm wondering, can you walk us through what daily life is like when it comes to sort of the things that make life fun, going out to dinner, going to a movie, maybe going to see a show? I mean, what do you have to do to participate in those things?
You have to be vaccinated, and it's actually pretty easy. It reminds me of, or if I still get ID'd sometimes at bars, but it's the same thing. You can either use the Excelsior Pass, the state and the city has one. You just go in, the hostess usually asks for proof of vaccination. It's either on the app on your phone, or you take your card out with your driver's license and you just show it, and that's it. I've been to one Broadway show since COVID, and it was very, very quick. It's a very easy experience. You just show your pass just like you used to show an ID to get in. So it's pretty simple. And, seeing the city, I've had this sort of weird privilege of watching New York City, particularly Manhattan, the business core, go from pre-COVID, what the numbers I was used to completely empty to now coming back to life. And it certainly feels busier than ever.
And I want to end with this because we've got places along the thruway corridor upstate that are to some degree back to fighting about masking again. How common is mask wearing in New York City right now, even with cases relatively low?
It depends on where you are. Masking is still required on public transportation. I was on the subway this morning. I saw maybe 2 people without masks, but the rest of us were wearing masks. In stores, it is now sort of a mixed bag, and I will say Mayor de Blasio, they have strongly recommended mask use indoors. They have not mandated it. But when you go to a restaurant, once you're in and show that proof of vaccination, most people aren't wearing masks. Outside, you have fewer people wearing masks because you are outside in a different environment. I know some offices have now asked people to wear them now that we have that new Omicron variant.
Yeah, I mean, your 7-day positivity rate is around 2%. In the Finger Lakes, I just checked a minute ago, it's like 10%. So we're in 2 different states. Katie Honan, a reporter for The City, a nonprofit, nonpartisan digital news platform in New York City. I appreciate your perspective. Thank you.
Well, we talked earlier tonight about the chain reaction of shortages impacting just about every level of care. And that is on full display in Danville, south of Geneseo, where a mother is fighting for her 21-year-old son to get group home care. Doug Embledge has that story.
TORRIE Garrison is holding her own personal vigil outside the group home where her 21-year-old son, Zachary, has lived for 2.5 years. He says the home was closed on Thanksgiving Day and her son's belongings removed while he was visiting his father for the holiday.
I want them to bring his belongings back here, and I want them to do it the right way.
Garrison says she's not alone, that many other families are sharing the same pain.
Most of the people here don't have any family to speak for them, so they pick on the weakest people that have no voice.
The State Office for People with Developmental Disabilities says it and its provider agencies, as well as most human service organizations across the country, are facing a workforce shortage of crisis proportions. While it's working to confront that crisis, OPWDD says it's exploring options, including temporary consolidation of group homes to maintain quality care and workplace conditions. But Garrison says what the state is doing to her son is illegal, that he, like any renter, is entitled to notice of eviction.
And the individual has, at minimum, the same responsibilities and protections from eviction that tenants have.
Beyond the law, this mother of a young man with autism says the forced move is not healthy for her son.
He doesn't do very well. He doesn't handle change at all. He needs everything to be the same. He needs to know what's happening. He needs to know yesterday what's going to happen next week. This isn't going to be good for him.
Our
heartbreaking
heart goes
to
out
hear.
to those families, all of it impacted by this crisis. The most passionate pleas we've heard so far, aside from that mother you just saw, about this hospital crisis have come from the people inside the facilities, fighting a new wave of COVID patients and total exhaustion.
Emily Gersh's continuing coverage of hospitals in Buffalo brought us to these healthcare workers who have had enough playing nice with their messaging.
People need to wake up, get vaccinated, wear a mask. Just do it at this point.
Respiratory therapist at Buffalo General Medical Center Nadine LOGEL-JARKA is angry at how the region is handling COVID. The hospital currently has about 60 COVID patients, and a quarter of them are in the ICU. The hospitalization numbers are similar to what they were a year ago at this time, and she didn't expect to be back here.
People are dying every day, and it shouldn't be this anymore. We've seen entire families be wiped out. And we shouldn't have to be put in that situation anymore.
66% of Erie County residents are fully vaccinated. Nadine says the majority of COVID hospitalizations are unvaccinated, and that's why the cases are still on the rise.
And until you've watched a child die or a mom give birth to a stillborn baby, that all could have been prevented with one shot. It's pretty sad.
Over at KENMORE Mercy, ER nurse VANESSA QUINN says they still lack the staff needed to treat the number of patients.
It makes you feel helpless. You do what you can.
She says the Catholic health system still needs to hire more workers to meet the nurse-to-patient ratio agreed upon after a 35-day strike.
I'm hoping that not too many nurses get depressed or, leave to go somewhere else, because we need them where they're at now.
As for LOGEL-JARKA, she says workers have been dealing with burnout, PTSD, and fatigue for almost 2 years now, and the only way to curb the numbers is through a higher vaccination rate.
If there's a 1 in a million chance that you could save somebody else's life, you should do it.
Emily Gersh, Fox Buffalo.
This hospital crisis could be further complicated by the discovery of this new COVID variant, Omicron.
While you may be hearing about this new variant a lot, you may not know exactly what there is to be concerned about.
So here's what we know tonight. The World Health Organization has outlined what it knows and what it doesn't. The WHO is unclear whether Omicron is more transmissible than other forms of COVID. They're also not sure if it causes more serious disease, but preliminary data suggests there are increasing rates of hospitalization in South Africa. Researchers say that could be due to an increasing number of new cases and not because of Omicron being more dangerous. WHO officials say from what they know right now, Omicron could pose an increased risk of reinfection.
And there are some key differences between this variant and the other notable variant that we've spent a lot of time talking about, Delta, which is still dominant in the U.S. The main difference between Omicron and Delta comes down to mutations. Simply put, the ways in which the virus has changed. Omicron has as many as 50 mutations, most of them within the virus's spike protein. That's what makes the virus attach to human cells. But it's worth noting mutations don't necessarily mean that a virus is going to be more transmissible or that it's going to cause you to become more sick. The director of the National Institutes of Health says these mutations are certainly concerning, but not a reason to panic.
But Omicron is the one with the highest number of mutations that we've ever seen, over 50 of them, which means it's kind of a shapeshifter in terms of the ways in which our immune system might encounter it.
Omicron vastly outnumbers previous variations of the virus. Alpha, the very first form of COVID we discovered, has just 4 unique mutations. Beta had 6. Delta, which health officials consider to be the most transmissible form of this virus, had 7. And now we have Omicron with 26 unique mutations.
The emergence of this variant has a lot of people asking, when does this end? Dr. Anthony Fauci answered that in a one-on-one with Jan Jeffcoat.
Point, and what is your metric to determine when this is all over?
Well, I think what it's going to be when the level of infection is so low in the community that it's not disruptive of what we do with our lives from an economic, from a social, from a personal standpoint.
Cause for concern, not panic. That is the messaging from the White House tonight as we wait for more information about the Omicron variant. We wanted to know how news of the variant is registering with New Yorkers, especially those who own businesses impacted by restrictions in the early days of the pandemic.
At this point, I don't foresee shutdowns again because nobody can afford to do shutdowns again.
For the most part, the people we spoke with had faith in their community leaders to navigate the uptick in cases and the unknowns of this new variant.
Among those leaders in New York communities, health commissioners. They've advised politicians at the county level since day one.
Amanda Hull sat down with Onondaga County Health Commissioner Dr. Indu Gupta to get her take about what we know about this new variant.
probably is very highly transmissible. The way with the speed it has spread within the many different provinces of South Africa and to Botswana and to some of the European countries, and now in Canada, there is a concern, of course, that it rapidly spreads.
A new variant on the minds of many after a holiday spent with loved ones and a month that is typically spent together on the horizon.
At this point, we should continue to stay on our plan, but at the same time, make sure you use those the public health protective measures.
But that comes with a stern warning from the health commissioner: keep your plans fluid.
However, be mindful if something new appears on the horizon, based on the science, you certainly can take that step at this point. I always will say never. I think we have evolved, the scientific community has provided so much information in such a short time that they have all the tools that they can come when they say in next 2 weeks, we'll have more information. I'm very optimistic about that.
And Dr. Gupta encouraging those who are not vaccinated that it's not too late for that first shot or a booster for those who are vaccinated.
Those who are unvaccinated are more prone. So I would say if you have not done so to get vaccine, please get a first dose of vaccine and then get the booster before you get to your loved one. I think it gives you good protection, and use those masks.
Dr. Gupta wants to remind everyone how quickly and easily misinformation spreads about COVID-19 and wants to remind people that the best places to check for your information about the new variant is either the CDC or the World Health Organization. When it comes to getting information on Facebook, don't. Reporting in Syracuse, I'm Amanda Hall.
A blunt message there. For 2 years now, you've seen her on your television screen a lot, digging into every question you've probably had about the virus. Liz Bonis joins us live in just a moment. But first, her latest reporting tonight, looking at whether the new variant poses a bigger threat than the flu or the other variants.
Our case rates have continued to increase and our hospitalizations continue to increase.
Well, scientists with the U.S. Center for Disease Control are tracking the Omicron variant worldwide and testing live strains of it against the current vaccines to find our best option for protection.
I do believe some of the measures it's considering will have a substantial impact on our ability to detect virus before it arrives here.
They've already put out this warning. It says seasonal flu, especially the H3N2 deadly strain of years past, is increasing right now during this COVID-19 Delta strain outbreak.
Looking at the CDC website last week, 14% of all deaths were due to viruses.
As this CDC map shows, the levels are ticking up, although most are still low for influenza-like activity. Justin Kobe says that means now is the time to protect against it.
Do we know anything about how effective the vaccine is yet against what's circulating?
This past week, it was 415 cases. 93% influenza A. So luckily, the H3N2 variant is covered in the flu vaccine, but it is on the rise exponentially.
So regardless of what's going on in the rest of the world, we still have a problem here. So that's why you need to get vaccinated.
Liz Bonis is with us tonight. Liz, we watch your medical reports on our local newscasts. It's a pleasure to have your perspective right now. Thanks for being with us. We've seen other variants of concern, for sure, over the course of the pandemic. Why do you think this one, why Omicron, is getting so much attention?
So if you look at the structure of it, and they were doing all this sequencing, what you're seeing is that when you looked at Delta, which was the 5th variant, it might have had, several mutations in it. But Omicron has what we know of at least 32, and that means it's very different than the others. So what we don't know yet is it does appear to spread rapidly. We don't know if it makes you really sick, and we don't know how protective the actual current vaccines are against it. And I think that's what's sort of raising the alarm in this one. The others have been just slightly off, which we know vaccines were pretty protective against. And in your body, they sort of acted the same way. There's a lot of questions about this one. And I have to tell you, from the medical journalism point of view, it is fascinating to kind of learn as we go and see the scientists just sort of learning along with us.
Liz, let's talk a little bit about boosters. We heard from Dr. Fauci just a short time ago that some 60 million Americans haven't even gotten their first shot. But for those who are sort of on the fence, there's this question of, do they get the first shot? But if they've gotten their 2 shots, do they get their booster? What's the latest guidance on that?
So it's been interesting since this hit. I've been digging into probably this question the most, and partly because you've probably seen in these 5 cases already reported, we are hearing that almost everybody was initially vaccinated. Some had had a booster even recently. So there's 2 schools of thought, and we're sort of exploring them both. One is when you get a booster shot, even if it doesn't protect against the Omicron strain, it boosts your own antibodies. And if you get them boosted enough, you're going to fight off pretty much anything in the body that would normally kind of be attacking it. But there's another school of thought that's very interesting. Nobody questions getting a booster if you are over 65, in a high-risk category, have a compromised immune system, if your doctor suggests it. But in that category of adults, 18 to 49 that are fairly healthy, there's been some discussion the last few days of people even that have written about previous viruses, like the flu virus, for example, that there's something called the original antigenic sin. And I find this fascinating because what it means is that your body will kind of respond initially to something. And then if you keep boosting toward the same thing, if they were to make another booster specific to Omicron, your body might not respond to it the way that it's supposed to. We don't know that to be true, but there are some that are saying we need to take a pause here, maybe the next 5 to 10 days while the scientists are looking at this. And before saying everybody should run out and get a booster, should the younger, healthier people perhaps wait the 100 days that Pfizer and Moderna both say it might take to have an Omicron-specific booster? And I think we don't know that yet, but I think it's worth asking the question. So it's been fascinating.
Well, you've asked so many questions over the course of the last year and a half plus, but I want to go back to something you said earlier, because as a journalist, I know that you find the medical piece of this and the fact that so much of the guidance and the science has evolved. But isn't that the most frustrating part to just the average folks out there that are looking for guidance on what to do next? How do we bridge that gap between the fact that the science will evolve and change with the need for a clear message to, oh, I'll volunteer and say, me, on what do I do next? Do I get the booster right now? Do I wait?
So I think that is frustrating for all of us. At the same time, many of us thought that this was going to be more like a cold when this virus first hit. And we started to see in some people it was, and in some people it was not. So I think when you're evaluating along the way, the thing I've seen the most that makes the most sense is it's always a layering process. So we want sort of one answer. I just want to say the vaccine's going to fix it, or a mask is going to fix it, or if I stay indoors or stay away from others. And in truth, any kind of protection, if you look at, getting in your car and driving around, it's wearing your seatbelt, it's driving safely, it's watching your speeds. Well, this virus has been the same way. There's not going to be a single step that's going to work for you. It's going to be, what is your own risk? Do you need a vaccine and a booster, a full vaccine and a booster? Do you need to avoid high-risk situations right now until we know more about this? I think the intelligent way to make decisions is not to look for one thing that's going to be the answer. It's to look at the things that make sense. And it's always sort of a collective, I'll use the word layering process, I think, that keeps us well.
And right now the guidance here in New York from our local and state leaders and on the federal level is to get the booster. So we'll keep an eye on it, Liz. Thank you.
The next part of our discussion. I don't want to cut you off.
In Monroe County. I just want to tell you, all my family's in Monroe County, grew up in Rochester, went to Syracuse University, and I love sharing this with you guys. So thanks for letting me be part of it.
Oh, we're glad to have you. It was kind of a thrill for a lot of us to meet you digitally. Thank you, Liz. The next part of the discussion tonight will look ahead. What will another variant mean for our lives? Which most of us had certainly hoped would be pretty back to normal by now. Tonight, we're examining the impact the new variant will have on things like children in schools, our already stressed and overwhelmed hospital systems, and the economy, which has already taken a dip as concern for this new variant grows.
We have one key group that is still in the early stages of vaccination, young school-aged children. The rush is on now to put together vaccine clinics to get 5 to 11-year-olds vaccinated ahead of Christmas. But schools are watching closely to see if we're about to see another COVID surge. Tony Black has that story from Onondaga County.
What I'm looking at is over Christmas break, with just much longer Thanksgiving break, I do think coming back that week of January the 3rd, we're going to see a big spike in our COVID numbers.
Thanksgiving has come and gone, and now kids are back in school. It's too soon to see what any impact from holiday gatherings could have, but school districts are preparing for what could happen after the winter break.
I think there's more gatherings too over Christmas.
Fabius Pompey Superintendent Lloyd Peck expects more families to gather this Christmas than they did for Thanksgiving. The district is going to keep calendars open when they return in anticipation of increased testing and quarantining.
And we have a new variant coming too, and I think that's going to affect it.
In East Syracuse, MINOA, Superintendent Dr. DONNA DESIATO trusts everyone is taking proper precautions.
And we know how important for our students the relationships with their family members, particularly their grandparents, and their extended family.
One of the challenges facing families with unvaccinated students is quarantines. It's supposed to be 10 days. Sometimes the 10 gets extended and there's no test out option.
Another member of the family tests positive, and then that extends the quarantine period for the other members of that family.
We asked how districts are coping with those lengthy absences, whether it be online options or in-person work.
We send home packets to the students, and then every day that they can log on remotely, and we have 2 hours of tutoring.
Well, parents are also trying to line up their children for vaccine shots, hoping for protection with the expected case spikes around the holidays.
Vanessa Rizzitano spoke to a group of parents at a vaccine clinic outside Syracuse about what pushed them to get their children vaccinated now.
After being sent home from school last year due to the pandemic, parents are desperate to keep their children at their desks for critical learning.
4th grade is a very impressionable year, and it's important he's in school.
And it's not just the education. Parents I spoke with are eager to keep their kids in extracurricular activities as they provide great benefits.
I think mental health was really difficult because the kids were so ready to be playing in a sport, and then to have it shut down because of the quarantine piece was really difficult.
Last year, the holidays were interrupted due to the surge in cases. Parents are hopeful that won't happen again this year with the vaccine rollout for the younger age group.
He will be fully vaccinated by the time Christmas is here, and hopefully nothing will stand in our way of getting together with family and seeing those that we love.
I have a mom who's 87, and it's always difficult when you expose them to the younger kids. We feel a little more comfortable when we're all vaccinated and trying to get together.
Since returning back to the classroom, students have been getting sent home for something as simple as a sniffle. The vaccine not only keeps kids in the classroom, but helps parents provide for their family.
We're self-employed, so it's tough for us to, have to try to fill in at work if someone has to be quarantined.
Dr. Stephen Thomas is the Director of Global Health at Upstate Medical University and joins us now.
Dr. Thomas, good evening. Thanks for being with us. I have one overriding question about this new variant, and I'm wondering, when will the scientific community, in your estimation, be able to tell us with some level of a definitive answer about if this thing, if I get it, am I going to get more sick than with Delta or something else? Will we know that at some point?
Yeah, first, thanks for having me. Yeah, we're going to know that at some point, but it's going to take a couple of cycles. What I mean by that is it's going to probably take at least 4 to 6 weeks for us to really have a firm grasp on is this truly much more infectious? Who is at risk of getting infected? Who is at risk of getting severely ill and potentially dying from this? Right now, what we have are just sort of anecdotes that are coming out of South Africa and some other countries. The news is positive, meaning if you're vaccinated, the illness seems to be mild to moderate, and most people seem to be treated at home. But it's going to take at least 4 weeks, in my opinion, to know that information with any clarity.
Dr. Thomas, if I've had 1, 2, now the booster shot, should I feel fairly protected that if I go to a movie theater or a show or out to dinner with my family that I'm going to be okay? Or do we need to, take it a little more carefully now with Omicron?
Yeah, so we know that vaccination and, anyone who is eligible for 3 doses of vaccine, if it's messenger RNA vaccines, should be getting 3 doses for sure. We do know that they are by far the best way to mitigate your risk of getting severely ill, getting hospitalized, and dying from this. We also know that it dramatically reduces your risk of infection and spreading it to somebody else. So there should be no question that people should be getting vaccinated. Now the second part is if you're going to places, public places or places where people can be gathering, we might be embarking on having mandatory masking. This is just my opinion. I'm not a policymaker, but I think if you're shoving a bunch of people together and if vaccination is not required, everyone absolutely should be masked. If it is required, I personally still think that people should be masked at that event.
When you go to the grocery store, are you in a mask, doctor?
I am in a mask, and it's not just for me, right? There's other people there, and it is possible. I mean, I work in the healthcare field. If I'm infected, I don't want to pass it on to somebody else, even if I don't have any symptoms or I'm just mildly ill. So it's not just a me thing. It's trying to protect my community.
Dr. Thomas, just a short time ago, we heard the Erie County executive who was, quite frankly, exasperated, talking about the caseload out in Western New York, calling it bonkers, how many cases we're seeing there, and talking about the potential for more restrictions. Do you foresee us getting to a place here in central New York and across upstate New York where we're going to go back to the levels of restrictions that we saw at the beginning of this pandemic?
Well, I certainly hope that we don't get to that point. And again, I'm not a policymaker. Those are for our elected officials. But right now, unfortunately, if you're in a room with two other people, the odds are one of you is not vaccinated, which means one of you is at risk for getting infected and having a bad outcome and transmitting to other people. So I know I sound like a broken record, but the way out of this thing is getting as many people vaccinated as quickly as possible. We absolutely know that works.
I hate being the downer in the questions, but I'm just curious because, Dr. Thomas, I have been listening to you with rapt attention for a year and a half, and then when the vaccines came, that became your mantra. And yet still, the level of vaccination has slowed to a point that it must concern you to some degree. What else can you say to someone in order to move the needle?
Yeah, so I think, there's lots of different reasons why people don't get, vaccinated. I mean, some people, they have very legitimate questions. They're concerned if they're going to have side effects. They're concerned if those side effects are going to impact their ability to work and make a living. Other people, I sometimes think we might overestimate the amount of access that people have to vaccination. Not everybody has the financial luxury of being able to miss a day of work and having ample transportation to go and get vaccinated. A lot of our disadvantaged populations don't have that, so I think that's part of it. And some part of it, which is just, it's a phenomenon and it bewilders me, is that there are people that have given up on what, the process that they used to use to make medical decisions, which was talking to their pediatrician, talking to their doctor, talking to their nurse, getting informed and making a decision together. And now they choose to believe what they see on social media, what they hear from radio or TV, talk show hosts. And it really baffles me because all they're doing is putting themselves and the people that they love at risk. So what I think we need to do is we need to be persistent. We need to be resilient. We need to figure out how to effectively and clearly communicate health information to people. And we need to instill confidence in them so that they can make the right decision for them and their families.
No, we're doing our best on all of those fronts. We're doing our best, and I know you are too. Dr. Stephen Thomas at Upstate Medical University in Syracuse, thank you.
Thank you.
Some schools across the state, in partnership with county governments, are taking steps to avoid missing class because of a COVID exposure. In Erie County, the Grand Island Central School District will try out a Test to Stay program. This would allow students who came in close contact to a COVID case at school and are not fully vaccinated to have a rapid test before the school day. If it's negative, the student goes to school. If it's positive, they go into home isolation. A student or staff member who's exposed to the virus at home, though, wouldn't be eligible for this program. Grand Island will start the pilot program on Monday. The health commissioner says this will allow everyone involved to figure out what works, what doesn't, before rolling the program out county-wide in Erie County.
Well, we are already seeing some of the steps New York will try to take to keep COVID from spreading this winter season.
That includes regulations for high school winter sports. Emma Quinn reports tonight from Schenectady County.
While masks were optional during the fall as most sports like football were played outside, that won't be the case this winter. NISPA officials say they're following the Department of Health's COVID guidelines, which state masks are to be worn indoors, including at schools, Dr. Robert Zayas, executive director of NISPA, says the Department of Health has no capacity limits when it comes to indoor events, and it will be up to individual school districts to decide if they'll allow spectators during this season. One of the Capital Region's biggest school districts, Shenendehowa, allowed 2 people per athlete to attend games last year. This year, the athletic director says they will be increasing capacity limits and make adjustments if necessary. NISPA officials add they won't be handing out any penalties for athletes or spectators who don't follow the mandates. However, that won't be the case if you attend a game at Shen. As of right now, traditional winter sports are set to play this winter. Unlike last year, we saw some sports played in a different time of year. For example, we saw football and volleyball played in the spring compared to the fall. But for now, reporting in Schenectady County, I'm Emma Quinn.
Well, let's take a look at more feedback from you, our viewers, weighing in on this topic. We asked you this: the Omicron variant is now in the United States. Does this have you changing holiday plans or rethinking your position on vaccine or booster shots? Eric says this: we no longer allow gatherings in our home unless they're vaccinated or they are very close family. I am fully vaccinated, he says. My spouse has received his first dose and plans to get his second dose as well. We started wearing masks again 1 week ago. John says, I would never change a plan from here forward unless I was positive or something was canceled beyond my control. I'm vaxxed and boosted, and I'm not concerned about becoming sick from it. And Adrian says, nope, not at all. I'm not changing anything. I refuse to live in fear. I'm going to continue to enjoy the holidays with my family. If that makes me selfish, then so be it. I'm tired of letting COVID ruin my life.
A lot of opinions there.
Well, we now know the pandemic shifted holiday shopping online last year, but this year, with shipping backlogs, some local businesses are hoping people turn back to in-person local shopping.
Will the variant put that in jeopardy? JT Fetch reports tonight from Saratoga County.
This new variant started getting attention just as Black Friday shoppers were getting set to score some holiday deals at stores, leading to new COVID restrictions announced by officials. But data out this week shows any concerns from shoppers may have been shaken off.
However, this could lead to a shake-up when it comes to holiday spending plans. National Retail Federation CEO Matt Shea said this week the new strain could steer hard-earned dollars to electronics, toys, and apparel, and put experience gifts like event tickets and vacations on the back burner. In total, nearly 180 million shoppers made in-store and online purchases during this past holiday weekend, exceeding the NRF's initial expectations by more than 21 million. Already here in the Capital Region, people have been shopping earlier and in person due to the ongoing supply chain issues that could possibly worsen with the new variant leading to new restrictions. The Saratoga County Chamber of Commerce president told us the county's sales tax revenue surpassed pre-pandemic numbers, up more than 18% over this point in 2019. And with concerns over the variant, he hopes people will instead choose what he calls the sure thing and shop local so they can see things in person. We also spoke with shoppers at a Capital Region mall to see how they feel about the new COVID strain.
Our small businesses have had a hard time in 2021 and certainly in 2020. And if we want them to succeed and to stay with us and survive, local people have to shop locally.
So far, I'm not panicking about it yet. I want to wait and see what scientists say, what doctors say, and just keep an ear on it for now.
The National Retail Federation CEO says there's confidence that consumers will continue to spend since it is a very different pandemic holiday season. This year, more New Yorkers are vaccinated and many are getting boosters. The hope is that it boosts the bottom line. In Albany, I'm JT Fetch.
We are joined now by Dr. Monica Gandhi from the University of California, San Francisco.
Dr. Gandhi, thanks for being with us here in upstate New York digitally tonight. We're very glad to have your perspective.
Thank you.
We have a top infectious disease doctor from Central New York who was just on with us moments ago, who believes that it will take 4 to 6 weeks for us to get an answer on what I think is a really burning question about this new variant. And that is, if I get it, is it going to make me more sick? Is that your view on this?
You know, early data actually is showing us that the Omicron variant is likely less virulent than the Delta variant. I completely agree with your other expert that it may take a while to get all the data, but we have some early indications that 90% of people who are in the hospital for COVID-19 in South Africa with the Omicron variant are unvaccinated. 23% of the population only is fully vaccinated. And there have been reports from South African doctors that it's a little more mild than what we've seen before. And then also, if it's been actually circulating for some time, you would see increased deaths going along with cases. And we're not seeing that yet in places that probably have had it circulating for a while. So I'm actually hopeful, along with some other people, that it's less virulent. But I agree with your expert, it's going to take a while.
Dr. Gandhi, I'd like to get your perspective on human behavior, because since the beginning of the pandemic, we have continuously heard from health officials, we can control this, social distance, wear a mask. And I'm wondering, what is your personal behavior now? Do you go into a grocery store with or without a mask? Are you seeing people? Are you going to events? Are you going to a movie theater?
Yes, my personal behavior is kind of back to more normal life. We do have mask mandates still in San Francisco, but I will say that, the way I've thought about this COVID pandemic is that mask distancing, ventilation, testing, contact tracing, they're tools, but they haven't actually been able to change the course of the pandemic that much. What changes the course of a pandemic with an infectious disease is prevention with vaccines. And second is getting antiretroviral treatments, which are literally around the corner. So it's almost like saying I can change the course of a virus through my behavior. I think that's difficult, and I think it can have extreme consequences on schools and colleges and other medical care. And so vaccination is the key to getting through. And you have very high rates of vaccination in New York. We have very high rates of vaccination in the Bay Area. And I'm hopeful that we're not going to see an increase in hospitalizations or deaths. And I will say that importantly, Omicron's probably been around a lot longer than we know. And in places of high vaccination, we're still seeing those low cases of hospitalization. Hot cases can go up, but the hospitalization staying low. That's very New York. New York has been staying very low with their deaths and hospitalizations, which is very fortunate, probably because of your high vaccination rates.
But do we stay in this vicious circle if people do not get vaccinated? As you said, we have high rates here, but not everybody's been vaccinated. So if they don't, do we just continue to go on this hamster wheel?
No, because luckily something massively just changed at the end of 2021 that we didn't have. The last time this happened, end of 2020, we got vaccines. What are we getting right now? We're getting treatments. So 2 oral treatments, molnupiravir and Paxlovid. Paxlovid, they have to hurry and authorize because it's 89% protective. It's a 5-day course of an oral medication. 89% protective for those who are unvaccinated and have moderate disease from getting severe disease, going into the hospital or dying. That's almost as good as a vaccine. So we have to be compassionate. There are some who have chosen not to be vaccinated, and that compassion and that allowance of how to treat them comes from this oral antiviral medication around the corner. Pfizer applied for an EUA about 3 weeks ago.
But in the meantime, what's the message on the vaccine from your perspective to convince someone who's on the fence, not someone who thinks they have some firmly held belief against it and is a no, really, I mean no, but somebody who's somewhere else in the middle? Does that person have to have a loved one go into the hospital? Does that person have to suffer something very close to them related to COVID, or can something else get through to them?
The one thing I would say for those who have been on the fence is that we are sitting in December 2021. We have had these vaccines authorized in this country since December 2020, and people have been using these vaccines since we got the clinical trials since summer of 2020. We have more than 18 months of data, and in large systems like the Mayo Clinic system, very safe. Kaiser Healthcare system, very safe. If I can look you in the eye and look in the camera, we have so much more experience with these vaccines now. We're really quite far into the pandemic, and I really hope that you'll consider getting vaccinated.
Dr. Gandhi, thank you so much for your perspective tonight. We appreciate it.
Really.
Thank you.
We want to close tonight with two main points we want you to take away. First, what the governor said today, that this new variant's discovery in a person who spent time in New York City is not cause for alarm.
And second, the message from the White House COVID response team echoed this week by Dr. Fauci. We have the tools we need, vaccines, boosters, and masks when they are necessary and appropriate or mandatory.
As always, our news teams across the state, from Buffalo to Rochester, Syracuse, and Albany, will be working tirelessly to give you everything you need to know as we navigate this new chapter of the pandemic.
You can visit us online, follow us on social media, and of course, turn your television to your trusted local news source. For now, I'm Michael Benny.
And I'm Megan Coleman. Good night.